This is Samira Daswani, the host of the podcast, The Patient from Hell. We have been wanting to record this episode for a very long time, and I am very excited to have with me two guests, one of whom you've met before. So I have Katie Coleman back on our show, and we have Julie, who is a hospice nurse, a very famous hospice nurse, for some of you who might know her already, on our show as well. Welcome, guys.
Thank you. I'm very excited that we have Julie on this episode. I've told this to Julie before, but as I was learning to cope with my own disease and death, that Julie was like the person that probably had the biggest impact on me when I found her videos. So I'm very excited for us to all be chatting here today.
Thank you so much for having me, and so nice to finally meet you virtually.
Yes.
Yeah.
Julie, should we start there? Should we talk about death and how the topic of death got you to enter Katie's life?
Just starting off strong.
No worries about this, guys.
It's the only thing I want to talk about. So yeah, for those of you who don't know, which are I'm sure many people, I'm a hospice nurse, and I turned a death and dying educator on the internet probably a couple of years ago, pretty randomly. I just sort of started posting on TikTok about death and dying facts that most people don't know that I took for granted being a hospice nurse. And I learned that because two of my friends' parents were dying, and I was just sort of rattling off these things that I just knew about that I say in my everyday life at work. And their response to me was like, whoa, how do you know this stuff? Where is this coming? And I forget that not everyone knows the things that a lot of healthcare workers know. So I started making videos on TikTok, and people were interested. And I think that's I know that's how Katie and I met.
Yeah.
And now I'm still a nurse. I'm still a hospice nurse. And, but now I also do this social media thing where I educate about death and dying to decrease fear around death and dying.
Thank you. I have a lot of questions. Katie, if you have questions, jump in. I know this is a topic that you and I have like spoken about, at least on this show before. And it is something that we both stigmatized.
Yeah, I was just going to add that, like how Julie and I found each other as we kind of dive into that is, I think we might have shared this on the last podcast that we were on together that we recorded. But we did a very large surgery for me that like nobody thought that I would ever end up having. But the goal of that surgery was curative intent from when I had started at a place that I was incurable. And so I had a whole lot of hope tied up into the fact that, okay, if I get through this massive surgery and somehow end up surviving, like I might be cured. And so 3 months later, when we found that there was residual tumors left in my liver, so the call that got communicated to me was that they had found new spots. And because it was kind of like a brief, like just trying to give you an update before the records hit your chart. And so the words new were used instead of residual. And so I panicked thinking if new tumors popped up I actually think it was like a 2-month, actually my initial scans that showed that were only 1 month, I believe. And so when I had found that, I was like, if new spots came back in a month, like that means this is very aggressive. And I'm not sure how much time I've got left. And so I went from being on this like high of like, oh, I could possibly be cured to like the plummet. Like that was worse than my initial diagnosis because I thought like, okay, this is it. And I got really fearful of death and I was spiraling and I didn't want to go back on treatment because I was currently healing from my surgery and in like one of the worst places physically and mentally. And so I started looking into what it was going to be like to die and trying to browse resources. And that's when I came across, which felt wrong in the first place. Like it felt wrong, like I was giving up to even be able to look those things up. And eventually I found hospice and then started looking for hospice information on TikTok. And that's where I came across Julie, and hearing some of her stories just brought this like immense peace to me. And it transitioned from a like, I'm terrified of death to hearing some of the ways that it could be like very peaceful to how you pass, or like meaningful, even though you're dealing with something terrible at the same time. That like completely transformed my fear of death. And then that honestly like inspired a lot of my advocacy, because I was able to move past the like crippling fear that I was feeling from death, and be able to like translate, kind of move past that into more things. So I know that's a little long ways to start it, but I want to share with everybody like the impact that Julie has had sharing, because I know I'm not the only patient that has felt that way from watching her videos.
Katie, really quick. I know you have told me this before, but like that still is, my heart is like exploding, and I just feels like I felt like I found you. And if, for anyone who hasn't watched Katie on TikTok, you are so vibrant and you're so articulate and you're so good at explaining everything that's been going on with you, or that went on with you, that I forget that you had those moments, or probably still continue to, or whatever, right? I do too.
Yeah.
I mean, everyone thinks about their own mortality will have moments like that. And then to have it be so intense and so real, and it's just, I forget. Even though you've told me, I still, it's like, you know, it doesn't hit you until like in this moment where I'm like, oh, wow, she really, I don't know. It's just always so mind boggling. Thank you for sharing that again. Even though you told me, it still really
Yeah.
means a lot in this moment right now. So thank you.
Yeah. It's
Okay, so
it's all like we all have a ripple effect and an impact on each other. And I love that we can all get together and even have this conversation, because I'm hopeful that like maybe this will ripple out and help other patients in
Yeah.
the same way that I've been impacted by that.
So I guess I have a question for both of you. There was something that you both said that I think have a sort of similar thread, right? There's this fear that comes when you start thinking about it, start exploring death. I'm assuming, be it your own mortality, or Julie, in your case, when you're talking to family members, someone else's mortality that they may be worried about or fearful of. And then there's this transition that happens from deep fear to acceptance, meaning I'd love for you guys to talk about that. Like, what's that transition like, and what gets you from fear to meaning, to acceptance?
Yeah. Do you want to share first, Julie?
Sure. So just from what I've witnessed, that was like one of my main things I wanted to help people understand is everyone is different. Not everyone will get there. But the main thing I saw was that the people who are willing to do something like what Katie did, which was like look up hospice, find people on TikTok that are talking about death and dying, feel afraid and say, I'm afraid, or I don't want to die, or I can't believe I'm going to die. Whatever those like really, really, really scary sentences are to say out loud and to even face and to accept, because we can deny our own fear all day long. We live in denial all the time, including me. So anyone that I saw not do that, just even cry or say, I don't want to die, or throw a fit, right? And be pissed off, be willing to say, I don't want to, or I'm afraid to, and then be willing to even just educate yourself a little bit, or even just the awareness around the feelings seems to be the step to the transition place where you could get to a place of acceptance. Maybe not completely, right? But there's something about being aware and acknowledging those really scary feelings and saying the things that you're afraid to say. Something about that seems to transform it. So that's been my experience.
Yeah. And for me, it came from so first it felt wrong. Like I felt like just as a society, we have a hard time talking about death, like understandably so. Like it's hard, right? Like it triggers not only our own fears, but it also triggers emotions and like sadness from people that we've lost. And so they're difficult conversations to have. But it felt like, especially because there's so much of the fight mentality around cancer, that like saying that to anybody else felt like I'm giving up. And it felt like I'm not willing to fight. I'm letting people down. Not only am I now dealing with the crippling anxiety of death and dying, but now I'm also dealing with the crippling anxiety of like letting people down by even like saying and acknowledging those feelings. And so for me, like, I couldn't process those things like with other people. And so, like, my husband was there watching me fall apart. And, like, thankfully, he knows what I need when I get into those situations. And he was like, I'm going to give you space. So, like, I went into the bedroom and I, like, cried for like all day, right? As I was like spiraling down this rabbit hole and trying to learn as much information as I could before, like, I got to a place where I'd processed it enough to have some conversations with him. But for me, it came from, like, first I was terrified to, like, look into anything. Like, it just felt like I was doing something wrong by, like, trying to investigate what it was like to die. Um, but then once I got over that, I also, like, where I personally found a lot of peace is when I started hearing about near-death experiences and end-of-life visions that Julie often talks about. And part of that was because I had an experience when I was in the ICU after I had passed out after my surgery. And I don't think that I had like a near death experience, but I did have an experience where it was something that I can't explain very well. And I share it personally with people very often, but not super publicly. But it made me think that there's probably more to life. And I'm not somebody that is particularly religious. I grew up religious, but I would consider myself like maybe more spiritual now, or I have my own relationship with God, or whatever we want to call the higher power. I think what everybody believes is very specific to them, which I think also makes death and dying taboo, right? Is because everybody has different beliefs. And so I think it's like I had to decide what that very personal relationship was going to be like, or what I thought was out there and next for me. And so when I saw some of the things, like my great grandmother passed, and she had kind of like a near death experience that really aligned with a lot of the things that Julie was describing with like end of life visions and stuff that people were having. And that was a couple years before she passed. And then I had this own experience of my own. And then I kept hearing how aligned a lot of these experiences were. And they were all very peaceful for the most part. And so, like, that made me, I'm usually somebody that researches things to like the nth degree, which I tried to for this stuff. And like, I got to a certain point where I was like, I don't feel like there are solid enough answers. And then I also hit a pivotal point of like, if there are, I don't know if I want to know them. This might be the one area that I'm like, I have a lot of peace in not knowing, and in just knowing what I do know. And so I'm going to just, I could be wrong about it, but I'm going to let that be what it is. And so that's what that transition looked like for me, of like, there was this terror, there was a lot of like taboo of like, if I'm not religious, like what happens to me when I die? Or if I am religious, like, and even having these conversations with other people feels wrong because one person might believe in God and somebody else doesn't. And so it compounded all that to me. And when I abstracted myself away from all of that and just thought like, you know what, it doesn't matter what anybody else believes. Like, we all have this common theme of like, we're all scared to death and we all want something better to happen in those final days. And that's kind of the piece that I came to from it all.
Okay, so I have to ask, guys. Okay, so let me maybe take a tiny bit of a step back. So I like Katie and Julie. I know we've just met, but Katie and I have had many conversations, and I feel incredibly grateful to have her in my life. And we both sort of tend to be similar, I think, in this regard, which is very data driven, very science oriented. Like, read every paper, every clinical trial. Like, just before when you joined, you walked into Katie showing me her fully robust information set of all clinical trials in the area that she has a disease in, right? So I think we tend to skew sort of in a similar archetype. So to hear Katie say that she found peace in the absence of quote unquote data, to hear her say that she found acceptance in a place of incredible uncertainty, and it was heavily driven by an end of life experience for, I'm paraphrasing, I know that's not exactly what you said, but that moment of the end is not the actual end. And then to hear her say that she found that solace from some of the work you've done, I would love to spend some time hearing a bit more about what you've seen happen, especially as a hospice nurse. I'm assuming you've seen this multiple times for many, many years across many families, probably different religious backgrounds. So just a little bit more on what have you seen from an end-of-life experience? How have you seen it be truly peaceful for the most part? Just a bit more on that would be great.
Yeah, I would love to. So I feel like I want to scream it from the mountaintops because I've been a nurse for 15 years, just so everyone knows my background. And I was an ICU nurse for most of those years, which Katie has been in the ICU before. And many people, the ICU is a wonderful place, intensive care unit. Many people make it out of the ICU because of the advancement of health care, right? So it's amazing. And I've also seen the awful parts of the ICU, which is where we really try to keep people alive no matter what at all costs. We don't talk about, and I'm being very general here, so not everyone, but it's not really talked about. Death and dying, people do die in the ICU, but it's usually not talked about, and it's usually, for lack of a better word, pretty gruesome because we're trying so hard to keep them alive for so long, and we can do so many things with so many different machines to try to do that in the end it's just like, it's just hard. So doing that for years and years and years made me be like, this can't be the way we're going to do this end of life thing. Like, if someone's going to die, there has to be a better way. And unfortunately, unfortunately, we're all going to die always. And another unfortunate thing is there's certain diseases where you're likely going to die from them. So if that is the case, how can we better serve this person? I'm going to get to the question you asked, I promise. But it's kind of long-winded. We have to better serve the person who has this diagnosis that is terminal. And I don't think doing everything possible to keep them alive is the thing, because there's far worse things than death, and that's suffering, I think, from what I've seen. So that took me to becoming a hospice nurse. And then once I was a hospice nurse, I needed a couple years to kind of like see, because it's such a shift in your brain when it comes to being a nurse. When you're so used to doing things to save someone's life, to kind of taking a more passive, not completely, but a passive role in how their body's going to do this. And it was fascinating and amazing. And it made me so passionate about educating about death and dying, because what I saw was, talk about data and science, that made me feel like our bodies are miraculous. Like, what I've learned over the years, but the first 2 years specifically, when I was really watching many people die what I would call a natural death, even though you were dying from something, you were allowing the body to die naturally, was that our bodies were built to do it. Our bodies, without us even trying, will do things to help us die and make it peaceful. They make you not hungry, or the body makes you not hungry. The body makes you not thirsty. The body makes you sleep. The more you do that, the more you get in that cycle of not eating, drinking, and sleeping. Your body goes into a ketosis cycle, which is different. It's not different than the diet, but the diet you're still eating, and so to separate those two. But you can go into a ketosis where you actually feel euphoric. You actually have a natural pain analgesic that makes you feel better. So just biologically, to me, it is like miraculous to have learned that, being a hospice nurse, and to see it with my own eyes. So like, as an ICU nurse, you get so zoned in when you're in healthcare about like which section of healthcare you're in. So you're so used to like being a certain way in an ICU nurse, giving all the fluids, doing all the things, that you don't learn the other things. At least I didn't. So to see this shift in how like being dry or being dehydrated at the end of life is actually helpful, I never would have known that as an ICU nurse. And then to see it with my own eyes is like, holy crap. Sorry, I was going to swear. Like, holy crap, our bodies are so amazing. And then on top of all that, you see things like visioning, right? Visioning is something that seems like woo-woo when I talk about it, right? But it's not. It's a part of the death and dying process. Not everyone experiences it, but so many people experience it that it's literally a part of like our educational books to talk to families and patients who are dying, because people will start seeing dead relatives, dead loved ones, dead pets, anyone that was meaningful and comforting to them during their life that has already died will start coming to see them. And or like sometimes it's spirits, sometimes it's angels, depending on what they believe, right? But it happens so often that it's a part of the educational process. And as healthcare workers, as a hospice nurse, once I hear patients saying that, we know they're about a month away from death. So it's usually about a month before they die. I'm sorry, my voice. I didn't realize it was good. I haven't talked this much in like a day or in like 5 days. I'm sick, everybody, if you don't know.
You're all good. You sound great.
I sound worse than I am, I swear. And I get so passionate, my voice is going. But so, and people will say, oh, it's because of lack of oxygen to the brain. It's because of a release of DMT, which I'm not like anti-theories. Hey, if someone can tell me why this is happening, I'm all for it. And I think even if we had a reason why it's happening, I don't think it discredits it. I'm not here to be like, oh, there's for sure an afterlife. I don't know. All I know is in watching people die a natural death, I am like, people need to know about this. People need to know about what it looks like and what happens to our bodies, because it's not as scary as we think. And when I die, like of course I'm going to die too, right? And then when I think of my own mortality and I think about if I got diagnosed with something terminal tomorrow, I'm still human. I'm going to have all the feelings, anger, sadness, scared. I'm still going to be scared. But I also know that my body will take care of me. My body will take care of me. And I know that because I've witnessed it. Did I answer? I could go on and on and on, ladies. I could go on and on and on. There are so many amazing things that our bodies do to take care of us that if we would just be willing enough to not be afraid, to learn about it.
I love what you said, and you definitely answered my question. And Katie knows this about me, but I don't know if you know this about me, but anytime someone answers a question, I usually have, 15 other questions that come up, and it's just how my brain works. So I do have a follow-up, because there's something you said that I think is so profound and kind of goes back to something Katie had alluded to, is what I heard from you, Julie. One of the things I heard from you is the body takes care of you. Right? Part of that acceptance, part of the natural process of dying is that the body takes care of you, and the body is designed biologically to enable you to die. And it's almost like our modern interventions have made that process more, for lack of a better word, gruesome. Right? We're like extending that artificially, and in that we're sort of preventing the natural mechanisms to play out. The part that struck me, though, is the body takes care of you. And I'd love to ask Katie a follow-up question, because, and Katie, I'm not going to put words in your mouth, but I can, from having been a cancer survivor myself, cancer is really tricky because your body's literally trying to kill you. Like, it is literally trying to kill you. So I do think there is, at least for me, I underestimated how much trust I lost in my own physical body from the experience. And it's taken me a good 3 years to build back even a baseline level of trust that I trust my body will do what I think I want it to do. Right? So then to hear you say that the body takes care of itself, for me, it's this emotional dissonant moment of like, but do I trust my body? But I need to trust my body to believe that dying is going to be a peaceful experience. So I'd love for Katie for you to jump in and respond to that.
Yeah, I have a lot of the same emotions, right? Because like, yeah, I trust that my body is like a complete jerk and growing all these tumors, like trying to kill me. Cool. But at the same time, I've also had a lot of experiences that like, also to see like how miraculous our bodies are through the experience. So like, I don't trust my body to alarm me. It's almost more like I don't trust my mind, because my body is usually telling me when something is off. But I am like rationalizing it, or like I don't trust myself to recognize something as a flag. Whereas my body, there's sometimes that like I haven't known about something that was off, right? But usually, like my body sends the signals and then I rationalize them away. Um, but the part that I think like I've also had a couple experiences where like I had a bleed during my biopsy. And so I went from an experience that like it's pretty rare to happen. Like when you have a biopsy of your liver, there's only about a 2% chance that you'll have a bleed. And I didn't know I had a bleeding disorder at the time. We discovered I had a bleeding disorder after that. Um, but I had like an experience where like during that experience, I had those feelings for the very first time of like, is this what it's going to be like to die? Like I hadn't, it was early in my diagnosis. I hadn't really had many like large medical experiences other than just like getting diagnosed. And like all of a sudden, just like in all the medical dramas, like there was a whole frenzy of a team like rushing around me and like all their skills kicking into action, and then like watching the ceiling tiles go across as like I'm wheeled down the hall and stuff like that. And so I had that experience from like, and that all happened. There was a delayed experience. After I had my biopsy, everybody thought everything was fine. And then my body was telling me things are not fine. And it took me a minute to actually convince the nurses that things were not fine before the doctors came back in and we noticed that there was a bleed. Um, but I went from that moment of like, I had instant relief of like, whew, okay, I made it through this thing, we're fine. To then like, after that, the bleed really irritated my diaphragm. And so it was really hard for me to like breathe in. Like it was very, very painful. Honestly, some of that pain acutely after it was like worse than some of the pain that I had acutely after surgery. Because like I couldn't take a breath, and like the nurses were like, just take a slow, deep breath. I'm like, I physically cannot. um, and so that gave me after I took about 7 days for me to recover from that, and they didn't do any interventions from that. The bleeding stopped on its own, and then my body reabsorbed the blood, and I walked a lot, and like slowly got back to this place that about a week later I was like in awe of the fact that like we didn't do anything. My body just figured out how to like take care of itself, and then like I was breathing again, and then I like had this immense appreciation for like I didn't recognize how lucky I am that my body even like knows how to breathe on its own. And I had similar experiences again after surgery when that got taken away. And then I had a major, they're not 100% sure what it was, but they think it was a biloma from my liver surgery of like they might have nicked one of the bile ducts. And so I had this big fluid collection in my abdomen that was huge. And there was some people that were like, oh, let's drain it. But very thankfully, my surgeon at the NIH was like, do not let anybody drain that thing. You are going to have to like perpetually drain it forever, and it's never going to heal if you actually drain it. And so we didn't. And I had a hard time believing that or dealing with that, because for 6 months I had this thing, and like it shrunk a little bit, but it was massive. It was like, I don't even know how big that is, how to describe that, but like way larger than like a softball, maybe like cantaloupe. And so there was this massive fluid collection that I had that I did not trust that my body was going to get rid of it. And then 6 months later, on one of my scans, like it had almost completely reabsorbed. My liver had started regrowing from my liver resection. And so I had those moments of like, your body is trying to take care of you. Like there's so much happening that you don't ever even think about, but your body is actually, granted, it has lost the manual for how to cure or how to take out cancer, but it still has all of these other pieces that it is actively trying to take care of you. And so I do think that that's part of what resonated with me, is because a lot of that was during that same period of time for me. And so like I was accepting a lot of those same facts of like, there are mechanisms in place here that like, although it's working against me sometimes, it's also working for me.
Can I say one thing really quick just so I can set the record straight? I want everyone who's listening and you two to know that I fully believe in modern science and medical and all of our medical advancements, right? Like, because because I'm so used to like delivering information generally in like in a minute, right? So it's like I have to keep it so general that I don't want people to think, which I don't think you guys think this, but just so everyone's clear, I don't want people to think that I think the body's just going to take care of itself. You don't do anything. I specifically mean basically when we know that someone is dying, right? We know that for sure someone is dying. This is it. This is the end. That is like the one clear thing I speak about. Other than that, it's like listen to our doctors, be an advocate for ourselves, be our own advocate. Katie, thank you so much for being like, something is wrong here. We need to do something about this when you had that bleed. But I still really believe in modern day science, and I'm grateful for it because we've made crazy advances. But in general, at the very, very end of life, let the body be the guide.
Julie, I really appreciate you clarifying that. And I mean, I don't think either Katie or me believe that you were saying anything otherwise, but I appreciate the clarification because you never really know when someone starts listening to a conversation on a podcast. So the clarification is helpful.
Yeah,
I do have
especially
a
with the
follow-up.
context of, oh, sorry, I was just going to say, especially with the context of like what I just shared, I want to share that those two very specific things were things you don't intervene in, but there are many, many, many things that I have had interventions
Yes,
from. So I am here because of modern medicine. So I
that's
do
right.
appreciate the clarification from that too.
So now that we clarified everything, I'm going to go ahead and like caboose it for a minute. Okay. Sorry. Of course, I'm a bioengineer. I'm a scientist. Like, yes, modern medicine is amazing. I'm standing here today because of modern medicine. 30 years ago, I would be dead. Like, all true statements, all data backed, right? I will say, though, that sometimes our fear of death and mortality skew decision making, right? I do think there's a trade off. And the more and more I speak to more cancer patients, especially those where you have a terminal illness and you're making a trade off on quality of life versus quantity of life, modern day medicine pushes you to quantity. I think it was just set up that way. The incentives are set up that way. The system is set up that way. I think, and our individual fear sometimes prevents us from looking at it from a broader view. And part of the reason I really wanted to have this conversation with you guys was to talk about that, because I think if we, including myself, were more accepting of our own mortality, maybe, just maybe, decision making would look different. Not necessarily, because I think there are life circumstances that are different for every individual. But I almost wonder if, and I'm talking like 6 months before death, I'm truly talking true end of life moments, right? I'm not talking early stage curative settings. I'm talking true terminal illness. You don't have line of sight into life beyond a few months. Where does modern medicine push you to? And does it enable you as a patient or a family member to have that conversation, to evaluate the dying process? So I'd love any reactions either of you have, and especially you, Julie, because you've been a nurse for a very long time and you've had the ICU experience and you've been in hospice. And I'm making a wild assumption here, maybe not that well, that you've had many of these conversations.
Yeah, it makes me really sad when like it takes a very, very good provider to have those kind of conversations. And unfortunately, like to me, it's like mind blowing that not every single oncologist, radiologist, I'm being general, but like that should be like it should be the conversation right off the bat. Not like you're gonna die, but almost. And it's hard, right? Because Katie's situation, like you are not dying, you are not dead, you are like so, and if you would have really just listened to like what the stats said, right? So there are these certain outliers where like miracles happen. Here is Katie, like fully living and able to articulate this like beautiful message. And there are, like, I'm trying to think of an example, like, it's so hard, right? Even me who does this every single day still have a hard time saying stuff like this, what I'm about to say on a podcast. But like, let's give an example of like pancreatic cancer. Okay. Pancreatic cancer is a terminal diagnosis for the most part, generally speaking, but like not really. I mean, there are, I guess, a few outliners, you never know, but that is the problem, is that people hear that, and because we are so afraid to die and don't want to admit that we're going to, they will hang on to this little thing of like, yeah, but not everyone. Maybe I'm going to be and I don't actually know percentages, but the 1% that doesn't die from this in 6 months. And I think we do a disservice to people because of that. Because how would you be living your life if you knew you were going to die in 6 months? And I feel like most people with that, I'm just giving that diagnosis just because it's pretty clear, but they are not told that. They are like, it's a grim diagnosis, but here's what we can do. And right, so then all they listen to is, but here's what we can do. And then 3 months into it, it's not looking good, blah 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 blah, but here's what we can do. And then they hang on to this, but here's what we can do, versus like, how do you want to live the rest of your life? These last 3 months, who do you want to see? What do you want to do? Where do you want to go? What do and I don't know the answer. I don't actually know the answer, because I get it. It's really hard. It is really hard to take away someone's hope. It makes me want to cry right now just thinking about it. But we do people a disservice by not being that honest, by not being that upfront. There's like soft and fluffy ways we can still go about it, but I think people can only make right choices for themselves when they know the reality, of it. And that choice might be, Doc, I wanted to do everything until my last breath. And that's okay too. You can do that. And then the last thing I'll say, and then I'll get off my soapbox, is I think we can take that kind of mortality. I think we can. I have like medicine brain. Can you tell? I'm like, I don't know if I'm even talking great.
We've been there. Definitely been there. Don't understand.
I think we can take that way of life and live our life like that now. Like, why are we all not thinking we're going to die in 6 months all the time? That sounds horrific, but I think that would change the way we lived. Like, understanding that, like, that could be any of us. That can be any of us. We are all going to die. So what does that mean? How do you want to live in this moment now? Okay, I'm done. I'm done.
I have so many thoughts on this too.
Take it away, girl, because you are, anyway, go ahead.
I have like very, very conflicting, like this is something I've been grappling with for the last 3 years, right? Because I have been in all of these. Just lost my AirPod hold. This is something that I have been like grappling with for the last 3 years, because I've been in all those situations. I've been in the conversation where somebody told me my treatment goals weren't curative. I've been in multiple of those conversations. And then I've also been that patient that was holding on, like in the ER when I was told I was diagnosed, my husband was looking up stats on what the survival rates for stage 4 kidney cancer, which at the time were 8%, for 5-year survival. They've gone up since then, thankfully. But I was crushed. And the thing that I repeated over and over back to my husband is like, it's not zero. Even 1% isn't zero. Like I can do it. Like I can make it through this. And it was the only thing that was keeping me from a very deep, dark rabbit hole. And when I did read stats that told me the truth, I went down a very deep spiral, and like was one of the worst places that I've ever been before, like the second time after surgery. And so like when I lost all hope, life was very miserable. And so I have a lot of conflicting feelings around this, because I also, being a very educated patient now and knowing as much as I do, I wouldn't have made the same decisions if I had anything other than exactly what I had. But at the time, like I had a general idea that what I had was different, but I didn't know to the extent it was different. But I was pushing based on a fight mentality. So like I think about this a lot because one of the first oncologists that I had, not one of the ones that I have now, but they ended up telling me like my treatment goals weren't curative, that I was on a treatment. We didn't know how I was going to respond to it, but that it didn't cure people. And I knew one patient who had reached no evidence of disease. And I knew we had different cancer, but I held on to that. And I was like, nope, you know what? I know it can happen. This is going to be me. This is going to happen. And it's hard for me to think about that thought because when I think of that thought in the context of other patients that have diseases that are well known, like I would not make that decision. That would be the wrong way to think about things. Whereas, so a little backstory on what I have is different is, so the tumor that we found, and I was still in the diagnostic process through all this stuff, but the tumor we found on my kidney, it was very large. And then I had a lot of tumors in my liver, but the type of tumor I had is typically known to be benign. It like almost never ever spreads. So I did have stage 4 cancer because it spread to my liver, but because of the uniqueness of how weird that was that spread is why I kept pursuing second opinions and why I thought like, there's a reason these tumors are normally benign. So if we can figure something out, like maybe, like who knows, but maybe like I could have a better survival. And so I was like looking to this one other patient and like hopeful that I'd respond to that treatment, which like I did respond, but I was never ever going to have the response she did, no matter what. Like as much as I believe in modern medicine and what it can do, the extent of disease I had, that the physician was 100% right, that drug would not have cured me. Like I don't even want to pretend that there's like a 1% chance. It just wouldn't have. But knowing that that other patient did gave me hope. And so I kept looking for second opinions and I kept looking for other options. And that hope kept me kicking the can down the road, until I finally did get to an option where I had a curative option. And like now I'm off of treatment and living a very like good quality of life that I have now. But I am the very, 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 very rare percentage that falls into, and it has 100% to do with the type of cancer I had. That also goes the other way. Like if this thing comes back, like that works very much against me, right? Because there aren't treatment options really, in the same way that there are for other people. But I've thought about this a lot in the context of like, how would I make those decisions now that like I know as much as I do as a patient? And how would they be different? And they would be. Like leading up into surgery, one of the conversations I was having that I had the biggest frustration around is nobody knew what I had was so rare. They were preparing for a catastrophic bleed. They didn't know I was going to like bleed out on the table. They didn't even know if they were going to have enough blood for the surgery. And so as I was having the conversations with all of these physicians, I was saying like, can you at least tell, like, what is my prognosis? Like, if I have 6 months more that I could spend with my husband, like living the quality of life that I have right at this moment, I will take that versus dying on the table on Tuesday. But nobody had those answers for me, other than like, there's a perspective chance that like, if you do make it through this surgery, you could have a long time. So that is the risk that I chose to take. Whereas now, like when I'm evaluating those things, honestly, the thing that helped me cope with like how to live in the moment and make those decisions was scans afterwards, because it was dealing with the anxiety and uncertainty from scans that helped me live 3 months at a time. And so I said, I knew whatever this 3 months was going to be, that's how I wanted to live life. Like I knew I could probably maintain whatever state I was currently in for about 3 months. And that's how I wanted to preserve my life. And I made decisions based off of that. And so I think of that the same way when I think of like now, disease ever comes back, knock on wood that never will. But I think about it in that context of like, what would life look like if I was on this treatment? How would it change from my current baseline based on what I am now? And is that something that I want to live for just the next 3 months? Versus, and also like taking into perspective of like, what are the chances there could be a cure? But oftentimes that's not the case. And I've even had the thoughts and conversations of like, and I wish these conversations happened. I don't think they do. Of like, what's a worse way to die? Like, would I rather go into organ failure from trying drugs versus like letting the cancer take over. And that's like a very morbid thought and conversation to have. But honestly, like in some circumstances, I would rather go into organ failure from medications I was on, because that would be less painful than the cancer taking over in certain areas. And so I think they're very, very complex decisions, and they're hard decisions for people to approach. But I don't know if I have the answers, but I wish there could be more open dialogue along patients, because my decisions have changed throughout my diagnosis. That's very long,
Yeah,
but sorry.
No, I don't think you apologize, because I am so glad you went on that path where you did, Katie, because I think that's the conversation that never happens. It just doesn't happen. Like I mean, and I know you know this because you work with patients as well, and so do we, and like it just never happens. And bringing that conversation up is so stigmatized. Just broaching the topic is stigmatized, let alone actually diving into the actual meat of the conversation. And I think it's stigmatized with providers as well. Like I distinctly remember this moment where, so I had early stage breast cancer, right? So curative intent from the get-go. And everything we've discussed happened in those first conversations, right? Of course, here's the 15 things we can do, and here's the plan, and here's the diagnosis, and of course you're gonna be fine, and all the data's in your favor. But the treatment plan was pretty aggressive. It was like 18 months of treatment, and it's brutal. It's brutal treatment. It's not exactly, take a pill every day and you're fine. It's some pretty gnarly things that happen to your body. And I remember sitting there, and I remember I was in the office. I was working full time. The oncologist calls me at like 6 p.m. with the final diagnosis, and we're talking through treatment plan. And I had just joined this new job. So it was like full glass, classic valley, full glass windows, like doors, everybody can see you. And I'm just like, oh my God, keep a straight face. Like you cannot break down. Have to have this conversation right now. There's no other option. And I just remember sitting there, like turned my back to the wall so that people couldn't see me. And I like stopped him midway, and I was like, look, I need to know what happens if I do nothing. If we didn't do anything, zero treatment, what happens? And this is a super senior doctor, like very, very senior. And he just like stops and he goes, in my many years of experience, no one asks me that. He's like, people don't ask me that question. And I was like, well, how else are you supposed to evaluate any other decision? If I don't know what happens if I did nothing, all other decisions are not grounded in anything. And I remember him telling me, I like distinctly remember the moment. He's like, Samira, you would not live 2 years. And the next 2 years would be the worst 2 years of your life. And you would be in and out of the hospital in immense amount of pain. And I remember him saying that, and I was like, okay, yeah, brutal treatment it is for 2 years. Got it. So it was just that moment, right, where we almost need to have that conversation. Sorry, my dogs have decided to join the conversation, you guys, but so I think I think even in the early stage settings it comes up, or it should come up, I should say.
Yeah, 100%. I honestly think that would help combat a lot of misinformation around cancer as well too, because you have all these people that are like, you see it everywhere, right? Like, oh, take this magical supplement and don't do anything because chemo's toxic and it's poison and it's killing you and all of those things. Whereas like, no, it actually does, like, and it's all this exact conversation of, right, like you need it in the context. Like if somebody is in the last month of their life and they're going under extensive chemo, like, no, I personally as a patient don't want to do that. But if the same person who that extensive chemo will give them a full life, 100%, let's do that. And so those are the conversations that I don't think are happening, which is what allows a lot of the misinformation to get spread on the internet. I'm the exact same way as you, of like, in my appointment, like I want to know that context of like, what happens if we do nothing? Like, I know this is a terrifying thought, but what happens if we do nothing? So that I know how to make my treatment decisions. And I've even thought of that, like if my disease ever comes back, of like, that is the evaluations that I would make. It's like, okay, what happens if we do nothing? Like, how much time do I have? Because like, I want to evaluate what my quality of life is versus like, if I go in treatment, and like gauging, like, even that helps in the fact of like, say you found something, you've got a big event that you want to attend the next month. And so asking that question of like, what happens if we do nothing? So I know, can I stay off treatment for a month? And how will that impact my decision making on like, yes, I want to be able to go to this event and still enjoy the quality of life, because really at the end of the day, quality of life is the most important thing. And so being able to like, okay, I can start treatment after that event. But without the context of knowing how aggressive something is or what happens when you don't take action, it's hard to make decisions on how to make action. And honestly, I was kind of thinking as we were talking about this here of like something that I wish existed for patients, because it's a double-edged sword, right? Like I also see patients in communities all the time, and I'm sure you do, of like their doctor has given them a prognosis and then they go complain in groups about them of like, my doctor's given up hope on me and he's told me I've got 6 months to live. And like, I was that patient that felt that way. Like I've felt those feelings. And so like, they're very valid feelings. But I think just like grief is a kind of a process that you go through, I think patients go through a very similar type of grief when they're processing this kind of news. And so I almost wish like those appointments might not be the best place to have those conversations, but I wish there was almost a way. And honestly, I want to have those conversations with my physicians. I don't want to have them with a different, like a therapist somewhere. I don't know why. Like for me, I want that conversation with my physician. And I wish there was a way that like you could have the conversation about treatment goals, and just like, here's what your options are for treatment. Here's what happens if we do nothing. Here's your treatment options. Feel free to choose. Take some time to think about this. And then I wish there was an option behind the scenes for patients to be able to flag, I'm interested in finding out more about hospice. I'm interested in finding out more about like what my prognosis is, or like some way for patients to indicate like, okay, I've reached this point that I want to have more of these hard conversations. We both acknowledge that this is going to be a hard conversation and this is something I've signed up for. So it's like, so much of what I think physician care is understanding what the patient's goals are, and patient's goals change as you go through treatment. And so having some way to be able to flag your provider to give them the insight of like, this is where I am currently, and this is the context at which I would like to be having these conversations around, I think would be
This
huge
is
help.
brilliant.
Yeah, agreed.
As you're saying this, I'm like, I don't know if I don't know if people are going to see us or just hear us, but I'm like shaking my head like vigorously. Like, yes,
somebody build this.
Can
Okay.
tell me what you guys think about this. What about a timeline? What I think that like have the doctor, like they see this day in and day out for the most part, right? Unless it's something like really, really rare. But for the most part, they're doing this thing and seeing this disease day in and day out. So tell me what you typically see. What can I typically expect?
Yeah.
What's not even like timeline of death. I mean, just like the timeline, like in 6 months, it'll be like this, or then this might develop, or then this might develop with cancers, certain types of cancers. Like I know as an ICU nurse and as a hospice nurse, I typically see X, Y, and Z. And that's what all my videos are about. Like I have videos that are like, what is it like to die from blank? Which sounds horrific, I know, but I think it's helpful to know most of the time when I see this person of such an age with this type of disease, these are the types of things I see just to prepare people. And it doesn't even necessarily have to be like, I don't mean death. I just mean in general, like, I think it's people don't know what they don't know. And I think a lot of physicians or anyone in medical and in healthcare, I think we take for granted that people don't have the foresight to know what's going to happen next. Whereas we kind of do because we see it so often with so many people. And everyone is different. I get it.
Yeah.
But it'd be helpful to know, like, hey, this is what I see all the time. So typically it's this.
So I feel
like we have free advertisement. We just queued up Samara here.
You actually totally yeah. So I'm gonna actually use that what you just said, Julie. I'm gonna use that to wrap up. So I'm looking at the clock and I'm like, we're obviously way over as usual. Katie and I, all of our episodes gone way over, and we always commit to another episode. So if you guys are up for it, at some point next year we should have another episode of this.
Yeah, and I won't be late.
That's all good.
I'm sick, hopefully.
We will hope you're not sick, or late is fine, but the sick part is important. So I will say I did not plant what you just said. Just for super duper clarity, this was not planted. But you did just give us a free ad. to Katie's point. That is actually exactly what we have gone and built. And we have not launched it yet, but it's coming out next year.
Oh my God, that's hilarious.
So we start with breast cancer, and the way we describe it is we describe the cancer experience like a treacherous hike, but you don't get access to a map, you don't get access to gear, and you don't get access to a guide. And if you're privileged, you get some gear, some guide, but nobody gives you a map, but you know what the maps look like. It's like, we know what these maps look like. I don't know the exact path I'm going to walk on, but I know the map. Those exist because clinicians have them. They have them. That's how they practice medicine. So our team has basically built maps for patients and families. And it goes from a new diagnosis actually all the way through the dying process for metastatic disease, including grief after for the family member. So that is actually what we are going to be launching next year. So I did not plan this, but I appreciate the feedback. So thank you.
Wait, is it like you and Katie are doing this? Who's we? Who's doing it?
We have like Medicare is the company that we have, and the podcast is underneath the company. So it's
oh, cool! Oh my gosh!
Wow. I'm not involved in any of it. But I wanted to, like, I got super excited when I heard that, because like I think so much of what we connect on is the fact that like we all have these shared experiences, and they're like nobody's solving the problem. And so like it's very refreshing. Like it helps you like align with the fact of like, yes, this is a real problem, because like this is being seen by across people, right? Like across industries, and like different people that have different points. I guess not industries, it's all kind of the same, right? But like different points of the same care kind of thing. And so like, I don't know, it feels really good to like be a part of those conversations, because like they're problems, but they're problems that like people are trying to solve. And I can't tell you how excited that makes me to try to make that better for other patients.
Thank you guys for joining this episode. I am walking away feeling very reassured that dying isn't as scary as I thought it was going to be. And I appreciate the two of you for sharing that, because yes, all the professional side is great, but I don't know, anxiety is real, fear of recurrence is real, and hearing you guys talk about it has actually given me a lot of reassurance personally. So I very much appreciate both of you for sharing your stories, for doing all the work you guys do, and for coming on this podcast and sharing that with us. And then I'm hoping, I know Katie's going to be on this episode again. Like she'll be back. I'm like almost certain. But Julie, if you're up for it, we'd love to have you back as well, and to hear about the amazing stuff you're doing next year to dive even deeper into the process of dying. So thank you.
Thanks for having us.
Thank you.
Julie, thank you for joining. It's been incredible to be able to have your perspective in these conversations, and I'll say just meaningful for me based on the impact that you personally have had on my life. So thank you.
Oh my God. You too. Thank you so much. You guys are so wonderful and beautiful and are doing amazing things. So thank you. I'd love to come back.
All right. On that note, see you guys next time.
All right, guys. Have a good day.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The content here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions.